So welcome everyone. My name is Saphir Hamilton. I'm the team manager for the Southern State Seminoles 13U football team here in Hempstead, New York. And we are delighted and privileged to have with us a special guest, Dr. Audrey Paul, who is the founder of Advanced Concussion Solutions, pediatric emergency medicine specialist, and is trained in pediatrics and pediatric emergency medicine. She received her undergraduate degree in biochemistry from Harvard College and completed her medical and residency training at the Mount Sinai School of Medicine in New York City. She's lectured extensively to youth sports organizations in the tri-state area in Florida and has given medical grand rounds regarding concussion diagnosis and management. Quite extensive list of credentials. Dr. Paul is PALS, BLS, and ACLS certified and a credentialed impact consultant. She has offices and founded offices here in Garden City, New York, as well as Westport, Connecticut, and also down in Florida, and raised two children who both were athletes on playing ice hockey. So wanted to welcome you, Dr. Paul.
Thank you very much. It's really a pleasure to be here and feel honored that I was asked to speak today. So I think Sefer wanted to we're going to keep this kind of informal because I know sometimes listening to somebody kind of go through a whole PowerPoint presentation can be kind of mind numbing. So I think we're just going to open the floor to questions if anybody has them. Just by way of background, I got into concussion management kind of on for two different reasons. One was more academic and the other one was more personal. So, on an academic side of things, I worked in the pediatric ER at Mount Sinai for a long time. We would see tons of kids come through with, concussions, and it seemed like at the time, like the emergency medicine staff really didn't have a good understanding or good grasp of, how to manage discharge planning for concussed patients. Like in terms of, return to play, they would make up random time periods. Oh, you can play after 2 weeks, 1 week, 1 day. Like nobody really seemed to know what they were talking about. And so, just given the number of kids that would come through with head injuries, it seemed important to work on kind of an educational platform for physicians and providers in the emergency department. So we did a national study funded by the American College of Emergency Physicians, looking at discharge instructions for concussion nationwide through emergency departments in all 50 states. So that was more the academic side of things. But on a personal note, my son was a hockey goalie, and he started playing hockey when he was about 6 and had a pretty bad concussion when we moved up to Connecticut, and really nobody knew how to manage it. He saw his pediatrician who was, tried to explain to him that it was a bruise to the brain, which is actually not what a concussion is. And we really felt like we were kind of in the dark in terms of trying to manage this concussion, because really there were no standardized protocols at that time, and it was just confusing and frustrating. And he ended up going on to having like 3 concussions total. So I've experienced on the personal side and the professional side. And I think, oh, wow, we just lost I'm in Florida. I think we just lost power. So
Oh, gosh.
anyway, so yeah, but so those are the kind of the 2 reasons. One was because, because I felt on a personal note that it was important to be able to provide evidence-based care to parents and their kids who are concussed, and provide appropriate guidance, and then also just to provide education to providers as well. So that's kind of how I ended up getting into the concussion field.
Oh,
So
wow. So Dr. Paul, you're telling me, my dad, when I hit my head when I was growing up, would shine a flashlight in my eyes and have me follow. You're saying it's evolved since then, the science
a little
behind
bit, but
concussions?
not by much, so yeah,
Okay. All right. Well, he also would have me, rub dirt in my cuts. So I think, he
yeah.
wasn't the medical advice I'm looking for. So I've got a few questions teed up. Participants, please feel free to type any questions you have in the chat, and we'll get them answered for you. But until then, I'll tee up a few. So we're all football parents here, not hockey parents.
Right.
Football seems to have a reputation for head injuries, and there's been a lot of press around the long-term impacts of head injuries, especially in football players. What would you say to parents of football parents who are concerned with that risk relative to other sports or other activities?
I mean, um, so I'm actually, this is coming from someone who, like I've always encouraged kids to play team sports. My kids played ice hockey. It's never really shied away from, I haven't had tell all my parents to have their kids play golf. I think that team sports actually offer a lot of constructive benefits for kids in terms of social development, emotional development. It teaches them responsibility, how to be team players, how to deal with adversity. So I think there's a tremendous value to playing a team sport, even from an early age, and not to mention just being in shape, having structure, staying out of trouble, So I think those are all definite benefits. Football does have a football does have a higher risk of concussion, along with any of the other contact sports. So, for example, ice hockey, football, rugby, and, any of those sports are also associated with an increased risk. Football specifically is about a 3 to 5% risk, or like about 3 to 5 in 1,000 athletic exposure risk of getting concussed, annually. So there is definitely that risk. Now, there has been a shift, and I'm sure you're all aware of that, going from playing tackle football to flag football and starting tackle football at a later age. So maybe starting tackle, playing tackle until you're about 12, and then switching over at age 12 when you're more physically developed to playing tackle football from flag to tackle. So I can't say that, that it's risk free. I think it's kind of a personal choice. The big thing is making sure that kids know how to play safely, that also they're playing within the same, physical group. So that's been a big part of like the Pop Warner strategy, where kids are kind of grouped by weight and size. Um, and so I think that can help as well, because I know personally, my son, I mean, the reason why he got concussed, and I know ice hockey and football are different, but in some ways they're not. Like he got concussed when he was 12. And so he had a very late growth spurt, but he was playing with other 12-year-olds. Like half the kids on his team had facial hair, and,
Yeah,
and he
it's a
haven't, he
strange
had,
age. Yeah,
and he hadn't even cleared the net to,
right,
like
right.
the
Yeah,
goalie net. So, so when you're playing football, that translates into like a kid who's like 4'1" versus another kid who's 5'1", and when those two kids collide, that's not necessarily, that's not a great outcome.
sure.
So I think that being mindful of that should help as
Yeah.
well.
And when we were talking yesterday to prepare for today, you mentioned your practice has seen so far this season a lot of gymnasts and
Yeah,
cheerleaders and even
we're not seeing as many football concussions actually. We're seeing a lot more gymnastics and cheer. And interestingly, and I think this speaks to actually making sure that kids are well trained, like appropriately trained in how to play the sport safely. So I think the largest number of concussions that I had seen in football was right after COVID.
Mm.
Because like all these kids were like, oh my God, I'm going to play football
I'm
because
finally
I
getting
wasn't allowed
out.
to do anything. So kids, they had no idea, they never played football growing up. And so they were starting football at, age 15, 14, 15, 16 in high school, and they were just getting pummeled because
Yeah,
they just had no idea how to tackle. They didn't know how to handle a tackle. And so I think that also contributed to like a higher incidence of concussion during that time period.
sure, sure, absolutely. So when we decide to play a sport, a contact sport, we are, of course, taking a risk. But what advice would you give to parents or coaches if they first suspect a head injury? So let's say we're in a game or a practice and there's a hard hit. What should coaches and parents be aware of, and how should we address that?
So there's a great resource actually. It's called the SCAT, which is it's a concussion assessment test. And they offer different modules. One is for, practitioners, another one is for athletic trainers, another one is geared towards just, coaches and parents who happen to be on the sideline. And so it just kind of goes through a very simple checklist of, what to look for if you think a kid might be concussed. Generally speaking, I always like to err on the side of caution because I always feel, it's better to miss a game than the whole season.
Mm,
And the biggest issues that I've seen have come up when, kids were, they get they sustain a head injury on, during a game. They seem kind of okay, but it's, unclear, but they go back in the game, keep playing, their coordination is off because they're concussed, and then they sustain a second injury. And so then their recovery just becomes that much longer.
Mm.
And so it just becomes so much more complicated. So I feel that, you're always better to saying, just saying like, hey, this is, you just don't look right. I think you'd be better, and just pulling the kid off the field. So
So if you're not sure, make sure that we're not putting them at risk of a second re-injuring
ex-
it and making it that much worse.
exactly.
Yeah. And so, I talked about my dad getting his flashlight in his fingers. Should coaches and parents self-diagnose if they suspect a concussion, or what? We
I
also,
mean,
how do you get a diagnosis of a concussion?
well, I mean, there has to be, first of all, a history of like a, head injury, but not necessarily so it doesn't have to be a direct head injury. You can get concussed from just from a neck injury, just from like a whiplash type injury, or even like, let's say a kid gets, punched in the jaw. So it's sort of an indirect. So it's either an indirect or a direct hit to the head that results in kind of a movement of the brain inside the skull that results, that causes a concussion.
Yeah.
And
Yeah. So,
so
so what is a concussion? You said earlier it's not the bruising of a brain, right? How what actually is it?
So the difference. So concussions are not structural brain injuries; they're more functional brain injuries. And so what happens with and that's why when you get an MRI or a CAT scan or an X-ray, you can't diagnose a concussion that way. And that's why concussion diagnosis has actually been so challenging, because it's really mostly symptom and physical exam
Oh,
based.
wow. So it's not
So
it's not a physical damage per se, or a swelling, or
no, no. So,
okay.
so what happens with a concussion is that you can think of like the brain being like, I don't know, like jello inside the skull, right? And
Mm.
so with like a bunch of cells inside. And so what happens is the skull gets hit, and the gel, the brain kind of rattles around inside the skull, and that kind of causes and like moves forward and back. And so that kind of movement causes stretching of those cells in the brain, the neurons, and that
Ah,
stretching actually causes cellular damage.
okay.
And
So it can
when
break some of those connections and
Yeah,
cause.
so
Okay.
what happens is it causes like an energy crisis.
Mm.
And so the mitochondria, not to get too technical, but like the mitochondria, which are the powerhouse of the cell, um, they just don't, they don't function properly. And so the cell kind of just, the neuron gets basically has cellular damage, and so it slows down. So the ability to transmit messages, which usually happen in like lightning fast time, now happens so
Uh,
much more slowly, because now the cells, neuronal transmission isn't happening as effectively. So it's
I
almost
see.
like, it's like when a baseball gets thrown at your head, normally you duck and you move out of the way. But I always tell concussed kids, like, if I send you back to play, you're going to see that baseball, and then you're going to be like, oh, there's a ball coming at my head. I think I should move. By that point,
Right.
it's too late, because
Because
everything
it's
is just,
rewiring that signal and it takes
yeah, the
longer.
signal
And
is
yeah.
so much slower,
Oh, interesting.
Yeah.
Yeah, so no wonder it's hard to diagnose, right? Because it's performance based. It's not, I've got a bruise on my arm, or a broken
Exactly.
bone. Okay.
Exactly. Yeah.
Huh.
And that makes it harder to also, because people don't believe that kids are concussed. And so it makes it hard in school and socially. And so there are a lot of other consequences of that.
Sure. And so if they're walking around and they don't know that they were concussed, there's all sorts of other impacts that it can have on social and school performance and just anger and other things, right? They can see other symptoms.
Yes. Yeah.
So, if we suspect a concussion, what do you recommend? Getting it checked out by a professional before moving along, or just rest and make sure they're kind of returning to normal before you get them back on the field.
I mean, I always recommend getting checked out by a professional, because there's a lot of sometimes, like, so there's two parts to a concussion exam. One is, you go through a whole list of like the symptom scale, which is at least, 20 questions, how's your headache? Are you dizzy? Like this, do you have neck pain? Do you have double vision? And it's like emotional changes, because concussions can affect a wide variety of functions, emotional, sleep, concentration, memory, vision, balance, and headache. So you kind of have to ask questions that address all of those different areas. And chances are, if you just kind of go by, if you ask your kid, do you have headache? And they're like, no. And you're like, okay, great, you're fine. But then the other part of it is like sometimes, kids will walk into my office and they'll be like, I feel great. And then I subject them to some what we call provocative testing, where we look at balance and visual tracking and exertional testing. Like I'll have them run on a treadmill or put them on a bike, and you'll see that like after 2 minutes they're just wiped. So it's pretty clear that even though they're telling you they're fine, they may not necessarily be fine. So I feel like, and so it's important not to send those kids back to school or back to sport. I mean, school, yes, but back to sport too early. So
Okay. And so if you're doing testing after a head injury or a potential head injury, doesn't everybody have like different abilities? Like some people might pass a test uh, easily before they hit their head and not after, but other kids might not pass that same test before. Like how do you set a baseline for what they should be?
So yeah, so baseline testing is it's very controversial. So impact, I'm sure a lot of you have heard about that. And the impact test has been very popular. It's a computerized test. It's kind of it tests, memory, reaction time, processing, and a lot of schools and teams use that kind of as a baseline. But the problem is, they've noted a lot of data, like test to test variability. So a kid who takes a test on a Tuesday will have a completely different score on a Wednesday. So it's hard to know which one to use as your baseline. So that doesn't tend to be great. So there isn't really that much need for baseline testing because you can generally tell if kids are concussed, even just by doing a lot of the provocative testing that I'm talking about, because generally speaking, you'll pick up, like if you really run them through like a lot of, exertional drills or visual testing, or, they'll start becoming symptomatic. And so you can kind of tell that way.
Yeah.
That being said, it's really important to know like certain things at baseline. For example, some kids will have issues with visual tracking at baseline, right? So there's something called convergence. So most kids well, I'm older, so it's different when you're, a little bit older, but like for kids, their near point is somewhere near their nose. But when you're concussed, they see double, like out to, like five to
Okay.
10 centimeters out. So there are some kids who are born with convergence insufficiency, so they may just have a farther point at
I see.
baseline.
Right.
So it's useful to know that. Or some kids have really terrible balance, and so like when you subject them to balance testing and they still can't walk a straight line, it's really good to know, well, they can't walk a straight line anyway, or they have an underlying history of like POTS, which is, like they just their blood pressure drops really, easily when they go from lying down to sitting up, and they might be like that at baseline. So it's really good to know these things before the start of the season. So that way, if they feel great, but they're still showing these symptoms, well, it's not the concussion, it's just that's where they are. So
Sure. I got it. Okay. All right. And so what's the worst that can like what's bad? Like let's say someone does go back and gets on the field too soon, another head injury. Like are we talking temporary damage, or what can this affect them the rest of their life if we don't do it the right way?
So I mean, the biggest thing is, there's like there's there's second impact syndrome, right? So and that's what I think most people are worried about, and that's why the whole CDC movement happened, because a child actually was playing football, got concussed, and then wasn't held out from the game, went back on was allowed to go back on the playing field, got a second concussion, had a severe brain bleed, and that was, and was permanently, like, didn't pass away, but was permanently disabled from that. And, every year we hear about, like, or, a couple of years we'll hear about a kid or a young adult who's on the playing field and, they sustain a concussion. They weren't, they never got pulled off the playing field, got a second concussion in a short time period, they had intense brain swelling, and then succumbed to that injury.
I see.
So that's, I think, what everybody was so fearful about.
Hmm.
That's called second impact syndrome. It's very, thankfully, very rare.
Okay.
So I think there may be 20 or 30 cases reported in the, over a several year period. And nobody really understands the mechanisms. The people who seem to be most susceptible to that seem to be young men in late adolescence, early 20s.
Okay.
So, we haven't seen a lot of younger kids getting that. So from the impact for the fear of like a second impact syndrome, I don't think we have to worry as much about that. But
Mm.
even though that risk is there, obviously, but the biggest thing is like once you get one concussion and then you start what I call stacking concussions,
Mm.
the recovery time can take so much longer,
Ah,
and
right.
I'm talking about like getting one concussion on the playing field and maybe recovering in a couple of weeks to now having to be out of school for like 6 months.
Wow. Okay.
And there are certain people who are just more susceptible to that risk if you have a kid who's had a history, and especially if a kid who like, let's say they had a concussion 3 months ago, they got better, they played football or hockey or whatever, got a concussion on the playing field, then got a second one in the same game. That kid has a much higher likelihood of having a very prolonged recovery.
I see. Yeah, and that leads to one of the parent questions that put in the chat. I've heard that once you have a concussion, you're more prone to having another or having more. Is that true?
Yes, it is true. Yeah. But I always find that question to be kind of interesting because I'm not sure if having that initial concussion has made you more susceptible to getting subsequent concussions or if you're just genetically predisposed to
Oh, I
being
see.
concussed.
That's
Because
interesting. Yeah.
I've never, like, I can tell you, I've seen kids literally like smash their head into a wall and, have a huge, like, hematoma, like, or bruise on their head and they're fine.
Huh.
Like you'll see kids who go through a whole season, they played football, and they never have any issues.
Yeah.
And you'll have some kids who get one small injury and they're concussed. So I do think that there is a genetic predisposition. Unfortunately, nobody's ever really studied that. That's my own,
Mm. It's
personal
interesting.
take on it. But
Yeah.
and I think that there's also I think there is there seems to be a genetic predisposition. So like there seems to be a strong family history as well.
Mm.
So
Yeah, my nickname in school was Head Damage Hamilton. I
yeah.
hit my head everywhere, but never got a
Okay.
concussion. And yeah, it's interesting. Another question from one of the parents was at the younger ages, like 5 years old to 7 years old. Uh, how common are concussions in football players at that age versus, you know, 12, 13, or high school? Is there a notable difference, or is it still a high risk?
So it's, I think they say about and like the age, they never, I mean, I don't think they ever looked specifically at that age group. I mean, as far as I know, but I know like in the ages from like 5 to 10 or they're saying it's about like a 4 to 5% risk of getting concussed. So, and I think that number increases as you get to middle school and high school, just because, the force of
It's
the
higher.
impact is higher. Yeah.
Sure. Okay.
I actually, and I have to say, like, I haven't seen, thankfully, I mean, I've seen very few younger kids get like little, like five, 4, 5, 6. It's very uncommon to see that age group get
Yeah.
concussed, or at least those kids don't seem to complain of concussion.
Mm.
Probably because, the impact isn't as high, right? They're small, they're low to the ground, how quickly could they possibly run? But it does
Yeah, for
happen,
sure.
I do
Yeah.
have see head-to-head collisions. The problem with I mean, and I guess not the problem, but the concern I think with kids starting football so young isn't so much the number of concussions that they get over a lifetime, but also the number of subconcussive hits. So it's just like an accumulation of like, very small head injuries that happen over a lifetime. And that's what people are concerned about in terms of long-term issues, in terms of cognitive development, risk of, dementia, risk of depression, and so on, and, so forth in adulthood. And so I think that's why, the now I guess the common wisdom is sort of leaning towards maybe starting, kids later, in tackle football and like not as early, not so early. So
Yeah. Okay. And another question from the parents or coach. Um, what are the quick first aid sort of diagnose or identifying concussions on the sideline in a quick, like, are there what are the, I know we talked about some of them, but what are some of the immediate symptoms that if we see it on the sidelines as coaches or parents, we should definitely pull people off and check them out more?
Well, first of all, like, headache, dizziness, nauseousness, if they're vomiting, any change in mental status. I've seen kids who are like, I mean, and these are kind of obvious, but like, kids are, they don't like you ask their basic, where are you? What time of day it is it, what, and also just, I would ask them like basic questions, like what, like who are your team, what team are you playing,
Yeah.
so and that kind of, which quarter are you in, that kind of thing, or if you're
Yeah.
playing hockey, what period, whatever. So at least they get, just to see how oriented they are, and if they show that they're disoriented in any way, confused, I mean that's an obvious sign, or if they're showing any signs or symptoms.
Yeah.
Y- y-
If our players know what quarter it is, I think we're in good shape.
okay.
But yeah, the great advice. And is there anything to I've heard don't let them sleep if you
Oh
suspect a
no.
concussion. What's that? Okay,
No,
that's
no,
just
no.
BS.
Yeah. I think, yeah, that's like that you shouldn't, like, you can let them sleep at night. In fact, you really don't want to wake them up every few hours. You want their brains to rest at night. I think, you can certainly check in on your kids, make sure that they look okay, but like if you feel nervous, but you don't have to wake them up every 4 hours, every 2 hours, and like shine a light into their eye and make sure their pupils are okay. So
Yeah,
yeah, I mean, I think if you're really at the point where you're that worried that you're waking them up in the middle of the night, you're not worried about a concussion, you're worried about a more serious traumatic brain injury.
sure.
And so there's like, and that's the big thing. Like, I think it's important to identify, like, if you have a kid who had, like we were saying, altered mental status, if they're vomiting, if they're complaining of like a severe headache or neck pain, or they have like tingling in their, feet or their hands, those are serious things. And those, I think that would be a reason to have them go to the emergency department for a
That
further evaluation.
that could be actual brain swelling or
Yeah, or
life-threatening type
spinal
of
cord
injuries.
injury, or yeah,
Okay.
exactly. Yeah.
Got it. Okay, good to know the difference. And another question from a parent: if they are concussed, what does rest and recovery at home and or school look like? Screen time, sleep,
So that's
focus,
a
like yeah,
so that's actually a great question. So concussions have, like, concussion treatment has changed a lot over the past decade. We used to have like, I mean, they used to really recommend cocooning. So basically, you would take a kid if it was concussed, lock them in a dark room, tell them to sleep it off for as many hours as possible until they felt better, and that was it. So they did a lot of studies, actually, notably out of, Pittsburgh and DC Children's, where they've shown that they randomized kids, one group of kids to like go back to school, like pretty much within 48 hours, and the other group to like cocoon and just, hang out in their house for 48, for a week. And they found that the kids who kind of got moving faster tended to have a much better recovery time, a much
right.
shorter recovery time.
So no
So
bed rotting, just
no
yeah.
bed rotting. Yeah, you want to get, like, I usually recommend 24 to 48 hours of strict rest. So like take it easy for a couple of days, but after that, as I mean, look, you have some kids who are so severely concussed they just can't function, but if they're not that bad, I would say I usually start them, at least for school, like, with a, like a quarter day, advance to a half day, 3/4 a day, full day, and then, once they can completely do schoolwork and everything else, we can start doing returning to play. But that caveat being said, that like now we've also found that an active recovery is also equally important. So we really want to get kids moving.
Yeah.
So after the first couple of days, it's important to have them at least start doing some light aerobic activity, like have them walk around the block a couple times a day or walk the dog. And then, once they feel like they can start moving, I'll put them on like an exercise bike, and, we'll start with like, 5, 10 minutes, and then kind of work up from there, because it's really important to increase blood flow to your brain in order for you to recover faster.
Sure.
And so I think those are the 2 points I try to tell parents. So
That's great advice. Yeah, thank you. So I'm going to shift gears over to football equipment, and helmets, of course, have gotten allegedly a lot better recently. Virginia Tech runs a independent testing lab to show rankings of head protection in helmets. but they've also gotten a lot more expensive. So you can go
Yes,
to Dick's and get a helmet for $100, or you can go online and spend almost 1,000 on
you can't.
on
Yeah.
new technology and new helmets. What do you see in that space of helmet and shoulder pad or other things as it relates to protecting the head against concussions?
I mean, so first of all, I guess it's important to note that like even though I mean um like I think it's there's no unfortunately there's no helmet that actually prevents concussion.
Yeah.
And so I think I think that helmets are getting better and better at protecting against more serious traumatic brain injury. And, certainly they reduce the impact, I guess, that the brain may experience. But the problem with concussion is that ultimately there's nothing that can keep your brain from moving inside your skull.
Yeah.
And so as
So if
good as
you
that,
if you're running 20 miles an hour and you stop,
your
the
brain
brain's
is
going to
still going to
slosh around.
move.
Yeah.
Yeah, you're still, but yeah, so the helmet's not gonna stop that. And so, so I do think that, the rate, the Virginia Tech, like the whole rating, their rating scale is definitely, I think it's important. I think it's a great, the good thing about it is that it's an independent system, independently rated system. So it's not like you have Rydell coming up,
Sure.
like rating helmets.
Yeah.
So I think that's really helpful. And I think this, they do look independently at like the effects of linear acceleration and rotational acceleration, which are the two things that have been shown to affect, have impact with concussions. But I still think,
They can only do
ultimately
so much.
you can only
Yeah.
do so much. Yeah.
Yeah.
And actually to that note, like there's also, the Guardian cap, which I've seen a lot of players use as
Yeah.
well.
Yeah.
And
What's the take on that?
so the Guardian cap, it unfortunately, like they came out with it does reduce impact like like everything else. Unfortunately, when they did a study out of the University of Wisconsin, and they had two randomized sets of players, and they found no difference in the incidence of concussion between the ones that wore Guardian caps and the ones that didn't.
Okay. Yeah, I saw even at the Virginia Tech data, they did some on there, and with maybe the really bad helmets, improved the score a little bit, but with the better helmets, it had almost no
Yeah, it
noticeable
doesn't,
impact. Yeah.
so it doesn't really do that much. So,
We've all seen the ads on Instagram and others about those neck bands as
yeah, the
well
Q
that said,
collar.
yeah,
Yeah.
what all right,
Q
does
collar
that
actually
actually help?
the people who designed it out of I think they lived in Wilton, which was the town next door to Westport where I used to
Oh.
live. So yeah, so we're neighbors, but
So did they pay you off or no?
no, they
Okay.
didn't pay me off. Yeah, they tried, but
I
yeah,
bet.
no. So the principle of the Q collar is kind of like you want to try to like basically the idea is to keep the brain, it's sort of like because it's the same idea with woodpeckers. You want to keep the brain from moving around in the skull. So their idea was like a balloon. If you like compress it, like compress the jugular vein, all that
Okay.
blood is going to be stuck up in your brain, and it's going to keep your brain from moving around in your
I'll give it
skull.
more padding up there.
Yeah,
Yeah.
exactly. So the idea is the Q collar is a collar that compresses the jugular vein, which never makes personally doesn't make me super comfortable because it does increase the risk of like passing out. Um, if you do like have a very, like the smallest possibility of having someone who's predisposed to like blood clots, it could increase the risk of stroke. So I've never been a fan of it. There's a lot of issues now that have been found with like a lot of the studies that have been published on the Q collar were funded by the people who designed the Q collar. So there's inherent bias in a lot of the studies out there. And so I can't, I don't, and nobody that I've spoken with at Boston Children's or CHOP or Pittsburgh actually, like, I mean, no concussion centers that I've worked with really recommend the use of the Q collar in terms of preventing concussion.
Got it. Very interesting. So what I'm hearing is there's no magic bullet. There's
No.
no matter how much money you spend on gear or extras, you're taking a risk with contact sports. But if you're taking that risk and you can um, you know have good matchups and put yourself in good situations where you're not likely to have a lot of hard head traumas, that's better. But the big thing is if you suspect a concussion, take the rest, come off the field, and get checked out.
Yeah, and life has risk, right? It's just, I
Yeah,
mean, concussions can have, can happen doing anything. So, I do think, the funny thing is like the things we should be focusing more on are, well, one thing is neck strength can certainly help.
Mm.
The other thing is, and I don't think anybody's really done a good like study on this, but I think visual tracking um, is important as well, sort of like reaction time. So, and kind of around awareness of your surroundings, especially in fast moving sports like football. So, if you have a player who has a great sense of like space and kind of what's going on and how to react to like somebody's coming at you, you might be able to kind of prevent injury. So, I think those might be some better preventative strategies to focus on.
Oh, that's a good point. Yeah, just to if there's impact coming to
Yeah.
prepare and react to it. Yeah, that's great. So those are the questions I had, and I think we hit on all of the questions in the parents chat. And please type more if you guys have any follow-up questions. But as we're coming up on time, any other advice to close us out with, Dr. Paul, on how football players and parents of youth football players can manage and navigate the concussion minefield out here?
I think the big thing, well, nobody asked this, but it always comes up is, first of all, I mean, well, as far as advice for parents, it's really important to be aware of your kids' symptoms and, not push them to get back on the playing field too quickly. You really want to make sure that they're completely healed before they get back into play. But that being said, they don't have to become completely deconditioned while they're recovering from a concussion. It's really important that they stay in, as much as they can, continue to like work out, stay active, as long as it doesn't exacerbate symptoms. And then the other thing is parents always say like, how many concussions are too many?
Yeah.
Like when is like, what's the magic number where my kid should stop playing sports, right? Or
Yeah.
like contact sports.
Great question. Yeah.
And so I think while it's sort of it's a combination of things. It has to do with there's no magic number, but for example, if I had a kid who had one concussion, but it was that severe that they had to miss like the whole year of school, and they were that symptomatic, then that would probably I would tell them not to go back to contact
Yeah.
sports.
Sure. Yeah.
Or if they had three concussions within a short time period. So if we're looking at like three concussions within 3 months, then I'm like, that's it.
Maybe it's not the
That's
right
like,
sport for you. Yeah.
yeah, exactly. So I think if I have a kid who I mean, my son had a concussion when he was 12, and he had another one when he was 14, and then he might have had one when he was 18. I'm not exactly sure, but they were so far spread apart that there were three completely separate injuries. So even though he had three concussions, I wouldn't say that's it. You're not going back to play hockey anymore. It
Sure.
has to do more with like how wide the spacing is and also what the recovery time is like as well. So.
Wonderful. Well, Dr. Audrey Paul, thank you so much for being with us here at the Southern State Seminoles and our parents. We are, I know I learned a lot and I thought I knew something about it. So thank you so much for taking the time.
No, this was great, and anybody you can, I think that Zephyr has my email. So if anybody wants to email me questions afterwards, I'm happy to chat, so,
Wonderful. Well, thank you for being with us. Really appreciate it.
yeah, thank you. I appreciate it. Thanks for the time.
All right. Have a good night.
You too. Bye-bye.